Health Minister Dr. Maisel Amperine Lyngdoh has urged a coordinated effort to tackle Meghalaya's rising HIV cases and drug abuse, citing a huge surge in infections over 9 years. The Health Minister stressed the need for integrated awareness campaigns, community involvement, and trustworthy support systems to combat stigma and encourage prevention. Departments have been directed to prepare for International Day Against Drug Abuse on June 26 as the government works towards a long-term health strategy, she noted.
So today we had a very important and critical review with Max Society Meghalaya, with NACO and the various line departments of the government of Meghalaya that all have a budget head for the redressal of diseases that are slowly becoming alarming in the state of Meghalaya. So we now have managed to have what we call the integrated health campaign that needs to be developed in the interests of discussing HIV AIDS, which is becoming alarming in the state of Meghalaya. Certain localities, communities are more vulnerable. Without isolating victims of HIV AIDS and without intruding into the privacy of their disclosure, Government of Meghalaya has to take some actions that will contain the spread of HIV AIDS. Today was one such meeting where there was this intra-departmental discussion on the matter. Otherwise, social welfare does their own thing, education department will do their own thing, health department will do their own thing, and at the end of the day, everybody's missing the target. We would like to see that we reduce these numbers, contain these numbers, provide necessary medical facilities for such victims. How does HIV AIDS spread in a community? The first thing, lack of information. Because we don't know what HIV AIDS is and because everybody wants to shy away from discussing HIV AIDS, likely people living with HIV AIDS do not even know what their symptoms are. What causes the spread of HIV AIDS? We are already aware. Our communities are advanced communities. We know that injecting drug users and sharing of needles is one big cause. But the point here is the community willing to discuss this? Are we willing to be there, knowing very well that the practice of drugs is becoming a big matter in our homes, our communities and our localities? Are we willing to sit and get off the judgmental horse and actually discuss how to deal and address this problem? On the one hand, provision of safe needles is a popular practice. But how do you popularize safe usage of needles without sending the wrong message that, okay, we know you're a drug addict, but we'll still give you the needles? We need to draw a line. What do we do? How do we do it? How best can we do it? Is something that needs urgent discussion. Second thing, everybody is judgmental when we talk about commercial sex working. So on the one hand, there are silent CSWs, but on the other hand, there are loud and bold CSWs. Is the community willing to sit down and talk about why is it that there is the need for a profession under the CSW, commercial sex working? So if our communities are not willing to let go and shed this judgmental approach, I think this problem will continue to envelop us. I feel that maybe it is time that we look at this problem, talk about the problem, make sure we know what we're doing, make sure that whoever is also practicing or likely a victim of HIV AIDS does not shy away from coming forward. We need to have systems which are trustworthy. And this trust that we need to give all of these vulnerable groups is something that we have to redesign and work on. And right now we are at that stage. Today was one such planning. We will be celebrating the International Day Against Drugs on the 26th of June. All departments now have been asked to prepare their programs. I am requesting MLAs to come on board. Everything can be worked out in the leadership of elected representatives. Whether you're an MLA or you're an MDC, come forward, join hands, and do what you can. Walk that extra mile and discuss this problem without being judgmental. Let's see how best we can work and find a way out and a solution. For the state of Meghalaya, you will not believe it, a 221.1% increase in the last 19 years is big, is very big. We have Tripura at 330% plus. We have Mizoram, which is again very high. We must make sure that this is not a headline that will be used to shame a state, but these are headlines these are details which should not allow any other concern except that of redressing the problem. I hope to see that we will be able to get around this. Very, very, very alarming indicators, and this is something that only a community can get together to deal with. We've seen communities in other countries where officers have also been part of programs and exposure trips. We have learned from their good practices. They have managed HIV/AIDS in a big way. Even our officers need to make sure that we know what are the best practices and how these best practices have contained and are controlling the threat of spread of HIV positive. We also need to know what are the issues of people living with HIV/AIDS. On the one hand is this aggressive campaign and aggressive treatment for HIV/AIDS, but we also need to look at what are the things that government need to do to step in, to assist, to provide for people living with HIV/AIDS. We must remember that with tuberculosis, Government of India has come up with several packages which help people living with TB to attend to this deficiency of nutritional input in the body when tuberculosis hits our bodies. Now we need to figure out, is everything that the Government of India doing enough? Is everything that they're doing actually percolates down to the communities? This is one thing that our government, in the leadership of our Honorable Chief Minister, is willing to do. We do not have, any ready-made solution. These are going to be attempts on a long-term basis. 10 years down the line, are we going to be reducing these numbers? These numbers should not increase. Now that is the biggest challenge that we have. And we will ensure that we at the same time deal with the problem, but at the same time do not allow anyone to target such citizens in the state of Meghalaya.